Viral meningitis is an infection occurring mostly in children under age 5. It happens when certain viruses invade the meninges, which are the tissues that cover and protect the brain and spinal cord. The meninges are arranged in 3 layers. The layer that actually touches the brain and spinal cord is called the pia mater. The spiderweb-like middle layer is called the arachnoid mater. The outermost and toughest layer is called the dura mater. Cerebrospinal fluid, which also protects the brain and spinal cord, flows between the meninges and over the surface of the brain. The most common cause of viral meningitis is a type of virus called enterovirus. Other viruses that can cause meningitis include the mumps virus, the measles virus, herpes viruses, and a variety of viruses spread by blood-feeding insects such as mosquitoes and ticks. Viruses that cause meningitis may be spread through the bite of an infected insect. However, the 2 most common ways the viruses spread are through fecal contamination, which can happen when hands are not washed after using the toilet or changing a diaper, and through contact with the body fluids from an infected person, such as through sneezing or coughing. Once inside the body, the viruses make copies of themselves and enter the bloodstream. Viruses travel through the bloodstream to the brain, where they cross the border between the bloodstream and the brain into the cerebrospinal fluid. The viruses spread throughout the cerebrospinal fluid and infect the cells of the meninges. The meninges become inflamed as the immune system begins to fight off the infection. Symptoms of viral meningitis in infants and young children include fever, irritability, loss of appetite, and trouble waking up. Symptoms in older children and adults include fever, headache, stiff neck, sensitivity to light, sleepiness, trouble waking up, nausea, vomiting, and loss of appetite. The symptoms of viral meningitis are similar to those of bacterial meningitis, but are usually less severe.
The inflammation and the alignment in the brain. This inflammation is commonly caused by an infection from either viruses or bacteria. This infection sometimes enters the bloodstream. This is septicemia. Meningitis and septicemia often develop suddenly and without warning. It can rapidly lead to fairly serious medical problems, or even death. And unfortunately, meningitis in its early stages can be quite difficult to detect. It often mimics flu-like conditions. Did you know, each year, the bacterial form of meningitis affects 1.2 million people worldwide, 80,000 individuals in the United States alone. The majority of people infected with meningitis survive, but up to 15% die. And depending on the forms of meningitis, another 20% recover with serious long-term disability and after effects.
Yes, neck fever, high fever, confusion, vomiting, theraphoria and hemophilia.
Turning sign is an indication of meningeal irritation. Lift the patient supine, flex the patient's hip and knee. Then extend the leg out the knee. Back pain and resistance to straightening is a positive turning sign. When the sign is positive bilaterally, it is even more suggestive of meningeal irritation. Okay, Tom, I'm going to bring your leg up, and I just want you to tell me what you feel as I do this. Okay. This is a positive turning sign.
When I cut weight with an operation when you cut the disease, next one is nuclear rush. Meningitis is caused by the cut.